So now I call upon Sri Krishna Babu Garu to give the message to the gathering. Krishna Babu Garu is the Additional Chief Secretary of Family Welfare and Medical Education, Government of Andhra Pradesh.
Ramaiah Garu, who has taken a lot of effort, and he has passion to make this happen, and all other dignitaries on the dais and the invitees. So we are happy to get associated with this noble cause. So Ramaiah Garu and his team, we have to congratulate and appreciate their sincere effort in this direction to make the people aware of the prevalence of rare diseases, and also bringing the stakeholders on common platform to see what best can be done, because we cannot rewind, so we cannot go back, and we cannot cure, as Ramaiah Garu has already told. So what we can do is to create an atmosphere where we can give some comfort and dignity of life to the people affected by these kind of rare diseases. Even though WHO says 65 in 1 lakh are affected by rare diseases, but as per the statistics, almost 5% of the population is affected by rare diseases of some kind. Maybe some are curable to some extent, some needs lifelong treatment, and of course some needs lifelong treatment with expensive drugs. So Government of India has come up with national policy for rare diseases in 2021, and at least we have some facility to at least get registered in some of the Center of Excellence, 12 whatever are notified by Government of India. But they are, compared to the population which is in question, almost like 7 to 8 crore population which is having the problem. So these Center of Excellence may not be definitely sufficient. So every state government has to have their own policy about how we have to deal with this issue. But unfortunately, the awareness and also the vocal representation of the people with this problem is not that great to attract the attention of the governments to set apart a considerable amount in the budgets for taking care of these kind of treatments. But we will try our best, as whatever Ramaiah Garu has suggested. So we have to have a multi-pronged strategy to deal with this issue. What we are doing is now we have made TIFA scan as one of the entitlement for any poor pregnant woman for getting tested in between 18 to 22 weeks of pregnancy, at least to understand any genetical issues with the baby, such that the medical termination of pregnancy can be advised in case some serious genetic issues are reported. So almost last year itself, a lakh of pregnant women have used the facility, which is made available as part of NTR Vaidya Seva. So definitely, I hope that this will be helpful to the at least parents, because once the baby is born with genetic defect, there is definitely, it not only add to the woes of the family, and it also affects the economic activity of the family in poor households. So this is one activity. Second, of course, I appreciate the offer of the organization which has come forward to help in training the health workers at the village level. So Andhra Pradesh is having a very strong network of the health workers at the village level. For each of the village secretariat with around 2,500 to 3,000 population, we have almost 6 health workers present in that particular village. So starting from ASHA worker, 1 for 1,000 population, then ANM. So ANM is on a permanent basis. Each village secretariat is having 1 ANM. Almost 3 for 3,000 population, even though sub-center from national perspective, national statistics is 5,000 population, 1 sub-center. But Andhra Pradesh at least take pride in saying that we have sub-center for each of the 3,000 population. And another CHO, Community Health Officer, who is a BSc Nursing graduate in each of the village secretariat. So almost 1 BSc Nursing graduate, 1 ANM, and 3 to 4 ASHA workers. This is the staff available at each of the village secretariat. So definitely, once they are trained to identify the rare diseases, we will have a very strong database. One is at least we should have a good database to plan any interventions. But the only problem is identification. They may say that is abnormality, but they may not be able to say what kind of disease, etc. This needs referral mechanism wherein the specialists at district hospitals and above, they need to identify and maintain a population registry, at least rare diseases registry, wherein we can get the details of the people suffering from various the disabilities. So this may be a step where we can at least try to build a good database about the people affected by rare diseases, such that this will become a stepping stone for taking up some policy initiatives. So second thing is, of course, he has also mentioned about India is a strong, India is having very strong pharma sector, and fortunately Andhra Pradesh and Telangana, both the Telugu states are having very strong presence of pharmaceutical industry. We have API manufacturing units which supply globally. So only thing is we may need to encourage them to make formulations and make available drugs which are generally available in cheaper, means at least reasonable cost. The type of drugs, see, muscular dystrophy, some patients we come across almost whenever we go to some major hospitals, etc., or field visits. So at least it is very pathetic, because the parents definitely expect that government should support them. But when you see, when you hear the cost of the one injection costing around 17 crores, so definitely it is not that easy to sponsor that kind of expenditure. But only thing is we may have to means upscale. Basically, once you scale up the production, maybe the cost may come down. But these kind of very expensive drugs, even though we may not be able to give at this stage, but at least majority of the diseases which are where some drugs are available at reasonable cost, definitely they need to be made available to the people at least at reasonable rates. Jana Aushadhi is a program of Government of India where Government of India maintains a chain of shops selling generic drugs with a MRP, fixed MRP, such that the quality and also price is assured to the population. So maybe we will also take up with Government of India, but from the organization side also, if you can just take up with Niti Aayog, Dr. Paul is very active in health sector. Similarly, ministry also, if we can at least list out some of the medicines which are regularly used for rare diseases, which can be made available at affordable cost. So that will definitely help. And if at all, I don't know, I will also ask our DME, Director of Medical Education, to prepare a list of drugs which can be given in the government general hospitals free of cost, if at all they are reasonable. Of course, each injection costing crores, etc., we may not be able to give immediately, but at least the affordable medicines, if at all a list is provided, definitely we can add to the our list of drugs being made available in the government hospitals and see that they are available. And another suggestion about having one center of excellence for Andhra Pradesh to ensure that the people with rare diseases are properly at least guided and properly registered and given means they help in taking benefit from this national fund where 50 lakhs worth of medicines can be given to the persons who are registered under this list. So maybe AIMS Mangalagiri or maybe KGH, we have 100-year-old institution, Andhra Medical College, with strong presence of all the specialities and super specialities. Maybe we will try either at AIMS or the Andhra Medical College, KGH, at least one center of excellence. We have declared that as center of excellence for certain diseases, but only thing is rare diseases needs notification from Government of India. So we'll try to see what facilities are required further at KGH to notify that as center of excellence for rare diseases and see what best can be done from our side. So other areas, so we'll definitely work with the organization. Maybe the people are very dedicated, passionate individuals are available. So I am sure that they will bring out a practical strategy wherein the state government can do further in properly managing the rare diseases. So we definitely want to work with the organizers, the team members who are selflessly working for the cause of the disadvantaged sections where nobody wants that kind of family member willingly, because it is a God's wish. So whatever is given, we have to try to manage and see how best we can move forward. So in those circumstances, whatever help the government or the community, not only the government, because even socially the community also has to support these kind of initiatives. I am sure that once some practical way forward is worked out, we are ready to work with them to ensure some solace to the families who are affected by this kind of issue. And our Honorable Chief Minister is very particular that we should do genetic mapping of the population. So he is taking up a massive exercise to have genome sequencing and preparing the disease profile of the population using advanced genetic analytics. So let us hope that the further whatever activities are taken up in identification and registration of the people will help them in accessing better Medicare, because once the condition is known, then at least we can plan for further thing. Means where are the facilities available, sponsoring them to those kind of facilities, and liaising with those organizations to ensure the people get reasonably good Medicare. So I sincerely wish that whatever 20 years of hard work done by this organization will definitely give definitely good fruits in the years to come. I wish that the members work with the same enthusiasm and take this campaign forward. Definitely we will do our best to see what best can be done from the government side. So thank you very much for organizing this second time. You are organizing the meeting in Vijayawada. So definitely being from Telugu state, so definitely you have that passion, and so we are happy that we will get some advantage of your presence in the organization to see that the AP takes up this on a concrete lines to be forerunner in this management of rare diseases. So thank you very much, and Jai Hind.